Resilience is an attractive concept which has been adopted in the development strategies of many agencies, but it needs to be operationalised. We need a way of framing resilience that helps us to document the core characteristics of resilient health systems. But it can't just describe resilience, it has to identify key leverage points where policymakers and health service managers can intervene to strengthen systems functions in circumstances of adversity.
Boko Haram is an anti-West militant group operating in the northeastern region of Nigeria. Experienced attacks from the group since the year 2011. The group targeted their attacks in form of bombings, military raids and robberies to law enforcement agencies and churches. These attacks were extended to mosques, schools, hospitals, and other public places. This created fear and panic among citizens. The Yobe State health system was majorly affected by these events. Health workers, especially those that are not indigenous to the states, fled to other states. Some health facilities were actually directly attacked with insurgents taking away drugs, medical equipment, and ambulances. In some instances, health workers were abducted, while others were killed by gunshots and bomb blasts.
A total of 39 interviews were conducted in Yobe State. The research team analyzed and categorized the information into 15 themes. These factors were confirmed at the group model building workshop in Abuja by the 11 participants comprising key stakeholders from Yobe State. The participants used these factors and others that emerged during discussions and from the rich pictures to create causal loop diagrams.
Group model building identified two major pathways of threat, one directly related to the migration of people, the other to the migration of health workers and their technical support. Group model building, however, also identified three major pathways of adaptation related to mobilization of political will, community resources and cohesion, and the actions of staff themselves within the system.
So Eastern Cape reports among the worst, if not the worst, health indicators in South Africa, and some of the districts report the absolute worst health indicators of all 52 of South Africa's districts. It's a province and a district that's often talked about in terms of being in a state of emergency and chronic crisis. And this in the context of South Africa, where we see the quadruple burden of disease, the world's largest AIDS burden of disease, the world's largest AIDS treatment program. So what we tried to do in our project was to listen, to engage, and to see whether the approach of group model building could help people come together and explore the challenges that they face and the realities that they face in a way that isn't just blaming, but that's oriented to understanding first of all and action secondly.
Using a group model building approach, we began by working with selected stakeholders to define the focus and boundaries of the case study, and this informed a series of structured interviews. We identified the key themes emerging from these interviews, and these were brought into a group model building workshop that included a wide range of stakeholders, from provincial policymakers to district managers, health service providers, pharmacists, ambulance drivers, many of whom had never met before. Using a series of systems thinking tools, including rich pictures and causal loop diagrams, the group began to tease out a shared model of the complex drivers of poor maternal health outcomes in their district. Through the process of developing and visualizing the causal loop diagram model, stakeholders began to unpack the complex ways in which multiple factors interacted to produce poor performance and maternal health outcomes in the district. Using the model, they could identify the interaction of feedback loops that both result in such performance being so intractable, as well as trying to suggest strategies for sustained improvement. One particular example of these interactions is the quality of leadership, which was shown to have a pervasive influence on the overall performance of the system by linking to numerous factors and feedback loops. But, as seen in the diagram, without attention to managing workload and, linked to this, patient waiting times and satisfaction, the impact of improving leadership and support on staff competence and staff attitudes would be diminished.
Systems dynamics provides us with a powerful analytical framework for understanding the adaptations of systems over time in the face of adversity. Group model building provides us with a methodology to gather together diverse stakeholders to negotiate a common understanding of that adversity and the common way of working together to address it.